A very good morning to all of you. Welcome to Pulmo Critic Care 2024, the inaugural conference on respiratory critical care, jointly organized by the Sri Lanka College of Pulmonologists and the Ceylon College of Critical Care Specialists. Today promises a day brimming with enlightening discussions and the exchange of valuable information. It is with great pleasure that I extend a heartfelt welcome to each and every one of you gathered here today. To commence our event, I kindly ask you to rise for the national anthem.
Sri Lanka Mata, Appa Sri Lanka, Namo 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 Mata. Sundara Sitarini, Surani Ati Sobhamana Lanka. Ranya Ganaya Mekamal Malaturu Piri Jaya Bhumiya Ranya. Appa Hatta Sapa Siri Setta Sadhana, Jeevana Mata. Nilikanu Mena Appa Bhakti Puja, Namo Namo Mata. Appa Sri Lanka, Namo 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 Mata. Obave Appa Vidya, Obamaya Appa Satya, Obave Appa Shanti, Appa Hada Tula Bhakti, Oba Appa Aloke, Appa Ge Anuprane, Oba Appa Jeevanale, Appa Muktiya Obave, Nava Jeevana Devini, Nithina Appa Kubudu Karan Mata. Jnana Veeda Vadavani Naragena Yanu Mena Jaya Bhumikara. Ekamavatake Daru Kala Vedina, Yamu Yamu Vinopama. Prema Vada Samaveta Duragara, Namo Namo Mata. Appa Sri Lanka, Namo 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 Mata.
Please remain standing. We will start the day's proceedings by lighting the traditional oil lamp. For that, I cordially invite the following dignitaries to join us. President of the Sri Lanka College of Pulmonologists, Dr. Niranjan Disanayaka. President of the Ceylon College of Critical Care Specialists, Dr. Dilshan Priyankara. President of the Sri Lanka College of Microbiologists, Dr. Malika Karunaratne. Vice President of the Sri Lanka College of Pulmonologists, Dr. Sumana Handagala. Senior Consultant Pulmonologist, Dr. Bandhu Gunasena. Joint Secretaries of the Sri Lanka College of Pulmonologists, Dr. Upul Pathirana and Dr. Sachini Senaviratna. Secretary of Scientific Affairs, Ceylon College of Critical Care Specialists, Dr. Anushka Mudalige. Representing the speakers, Dr. Mahen Kotalavala, Chief Organizer of Pulmo Critic Care 2024 and Council Member, Dr. Dilisha Vadasinghe, Country Manager of Getz Pharma, Mr. Saman Disanayaka, and one medical officer from the audience. To deliver the opening remarks on behalf of the Ceylon College of Critical Care Specialists, I would like to invite the President of the Ceylon College of Critical Care Specialists, Dr. Dilshan Priyankara. Over to you, sir.
Good morning to all of you. I'm not going to take much of your time. So when we planned this event, actually, the concept came to me like a couple of years back, that we need to know about what we do, especially in pulmonary critical care. And I think I had a chat with Dr. Geeta also, and he said that yes, we should do something. But after that, with work and also it just pained off. Then I thought that this is the best time, because we see a pandemic or an epidemic of an respiratory tract infection going on throughout the country, and we see a lot of patients who are coming to ICU, and majority of the time that we don't know what's the organism, what we are dealing with. So I thought this is the best time that we take up this challenge and collaborate with the Sri Lankan College of Pulmonologists and have a symposium of this kind. But I never expected that it's like this grand. But I would like to thank the Sri Lanka College of Pulmonologists for taking up all the coordination and event organization to make this is a grand event. And we hope that this will continue in years to come, as an annual event addressing various topics. So I think we have a very good lineup of talks and case-based discussions, and hope all of you will enjoy, and you gain a lot of knowledge, and also you collaborate with the other disciplines as well. Thank you very much.
Thank you, sir. Now, to deliver the opening remarks on behalf of the Sri Lanka College of Pulmonologists, it is my distinct pleasure to invite the President of the Sri Lanka College of Pulmonologists, Dr. Niranjan Disanayaka.
Thank you very much. It is indeed a pleasure to welcome all of you to the inaugural session of Pulmo Crit Care 2024. And we hope that it will be 2025, 26, and 27 and beyond, an annual event of our calendars of both colleges in future. So we thought of discussing this very important topic of community-acquired pneumonias, hospital and ventilator-associated pneumonias, as well as pulmonary critical care, because a lot of patients who present to the hospitals have these symptoms when they come, and if not diagnosed and appropriately managed in the correct context, these patients will probably evolve into severe pneumonias and sometimes die. Pneumonia in Sri Lanka is the 9th most commonest cause of deaths, and unfortunately the landscape of pneumonia in Sri Lanka is ever changing. So earlier we knew that the common pathogens that are there in the community, like streptococcus, were the main culprit, but there are some studies that have been done regionally in teaching hospitals that shows that there is a significant change of the etiological agents, hence the diagnostic approaches to pneumonia, even a simple community-acquired pneumonia, should change. And disseminating this knowledge would be very, very important to improve the patient's clinical outcomes. And especially, we as the College of Pulmonologists would like to have collaborations with other like-minded colleges in improving patient outcomes, and this is the first such endeavor, and I'm really thankful for the College of Critical Care Specialists for agreeing, and at the same time the resource persons from the Sri Lanka College of Microbiologists, whom without we can't conduct this type of a meeting. So hopefully pneumonia, which was actually called the captain of men of death, and still is a significant factor in causing more mortality, in increased hospital admissions, as well as increasing amount of expenses to the healthcare system. Hopefully, together with like-minded colleges, we might be able to mitigate its impact. We really need to improve the diagnostics of pneumonia. If we want to have good antibiotic policies implemented in hospitals, one of the most important aspects is to improve the diagnostic, point of care diagnostics in pneumonia in Sri Lankan context. Or else we will not be able to implement a proper antibiotic policy. Because as clinicians who are in the first line of defense against pneumonias, sometimes we are at a dilemma on what antibiotic to give. And especially when the patient is very sick, we can't take any chances in managing these patients. But if we have a point of care diagnostics with possibly the resistant patterns coming to us within about 1 day if possible, then I think we might be able to improve most of these patients' outcomes with minimal expenditure and with minimal antibiotic resistance. So whatever we advise about the antibiotic resistance, unless we improve the diagnostics and the resistant patterns identification at the early onset of pneumonia and even other infections, I don't think that our efforts will succeed. So hopefully together with like-minded colleges and College of Microbiologists, College of Critical Care Specialists, College of Physicians, Internal Medicine. When we get together, I think we can stress this need of having improved diagnostics and improved care for our critical ill patients with pneumonia, so that we together might see a reduction in the pneumonia deaths in the near future. So that is one of the major steps that we are taking today to get these likely-minded colleges together. So hopefully we might be able to convince our policymakers to make differences and to give us the necessary resources in managing these patients. So I hope that you will have an interesting session today. We have lined up the community-acquired pneumonias, the usual differences, and then what are the when we should suspect the unusual pathogens. How would you measure the critical care with the severity of the pneumonia? And then we will go into the HAPs and the WAPs, where there will be a lot of controversies, a lot of questions that are asked and answered, and then we will go into the critical care, managing the critically ill patients with pneumonia and type 1 and type 2 respiratory failure. So these will be very interesting topics, and we are planning to make it interactive as possible. Hence, we are sitting in a round table here, and we will be disturbing the speakers at midterm, and at the same time we have given about 20 minutes for discussion. So we need this to be a discussion-based symposium rather than we giving lectures about the management. So hopefully you'll be making use of this opportunity to the maximum effort. Thank you very much, and hopefully we will have a beautiful session, and you will have a wonderful time here. Thank you.
Thank you, sir, for your wise words.